If you're struggling with persistent urinary leakage after prostate surgery for prostate cancer, keep watching this video. Urinary incontinence after a prostate surgery like a prostatectomy is common, but there are options available to help manage it, including penile clamps. In this video, I'm going to walk you through what penile clamps are, how they work, when they might be a good option, and how to use them safely and effectively. I'm Dr. Alex Hill. I'm a board-certified physical therapist, and I specialize in pelvic health and oncology. Make sure you subscribe to my channel for more videos on pelvic health and cancer survivorship. Remember, before you try a penile clamp, always check with your medical provider first. These are not for everybody, but they can be very helpful for people who have persistent or bothersome urinary leakage. So first, what is a penile clamp? So a penile clamp is a medical device, and it's used to help with controlling urinary leakage by applying gentle pressure to the urethra. You can see here a pelvic model. This is a cross section of the penis, so these are the muscles within the penis, and you can see the urethras at the bottom of the penis. So with the pressure from the clamp, that pressure is basically closing off the urethra so that you don't leak. It's gentle pressure, it's non-invasive, and it's an external option that can be used to help with your leakage, which again is common after a prostatectomy. Again, clamps work by compressing upward against the urethra so that there's no urine that comes out, but they're designed to be adjustable and padded for comfort and allow for blood into the penis. You can see that the pads are pretty squishy, so they are designed for comfort, and when it's removed, then you're going to be able to urinate. Because they're pretty easy to use, these are really helpful for short-term use for specific situations like exercising, social outings, or when you need more control over your leakage. Penile clamps can be a helpful option for you if you have persistent stress urinary incontinence after a prostatectomy, you have leakage with coughing, sneezing, with movement, or with exercise, or if you want to reduce the need for absorbent pads or diapers in certain situations, like if you're at work, you're at an important meeting, or even just going out to a social event, or if you need temporary control of leakage for specific activities. But they are not for everybody. So if you have significant nerve damage, decreased or altered sensation, especially in the penis, poor circulation, genital pain, skin difficulty, or difficulty using your hands and fingers because you do need a little bit of dexterity to get these off and on, then these may not be a good option for you. There are other options available, but just make sure you talk with your medical provider. Using a penile clamp correctly is key to safety and comfort and success with not having leakage. So you first need to choose your clamp. There's a couple different ones on the market. These you can get on Amazon pretty easily or from the websites. So you can see that each set comes with the actual clamp itself, plus different sizes of the pads. It's important to use the right pad size to make sure that you're getting the correct occlusion, but it's also not going to be too tight. You're going to just rotate it, and then you can take that pad off. And then you can see the different size pads here, so you're gonna choose the one that's most comfortable for you. The sets may have some instructions on measuring around the shaft and determining which size you'll need, or you can always use the largest pad first, for making sure that it's comfortable for you, and then if that's not occluding enough, you might still be having some leakage or it's not snug against the penis, then you would go down a size. Once you know what size pads you need, then you're going to place it gently along the penis. You're going to place it midway down the shaft, so you don't want it too close to the head of the penis or too close to the base of the penis, close to your body. Again, it should be about midway down the shaft. You're then going to adjust for comfort. So you can see that there's different levels depending on how tight you need it, and so you can keep pressing it down, and you're going to get to the point where it's going to feel comfortable and snug. I do recommend first trying it on your finger first. I'll show it on my thumb here, and you're just pressing it down until you get to the point where it's a comfortable, snug sensation at the top and the bottom. You may need to adjust it a little bit to make sure you're getting equal pressure at the top and at the bottom. When you have the clamp on, you should not feel any numbness, tingling, or excessive pressure. You also want to limit using it to only 1 to 2 hours at a time, and then you'll remove it for normal blood circulation and to urinate. You also want to avoid using the clamp all day, so you can alternate with other incontinence products like pads to prevent skin irritation at the penis or pressure injuries from the clamp. And finally, monitor for skin changes every time you remove the clamp. So you want to check regularly for any redness, irritation, swelling, or discomfort or pain. If you notice any issues, stop using it and talk with your medical provider. While penile clamps can be effective, there are some other precautions that you need to keep in mind. So you don't want to wear the clamp too tight. This can restrict blood flow and cause discomfort and other issues. You don't want to use it if you have neuropathy or poor circulation. This can increase the risk of skin breakdown, and you never want to sleep with it at nighttime. Now, penile clamps are just one external tool for helping to manage urinary leakage after prostate surgery. You should definitely be doing pelvic floor exercises or Kegels. These are when you are repeatedly doing contractions of these pelvic floor muscles to help with strengthening, endurance, and coordination. This can help with managing the leakage and reduce it even further, but the penile clamp can be helpful to use, again, in certain situations as you're working on actively reducing that urinary leakage. Besides pelvic floor exercises, you should also look to work with a pelvic health physical therapist. They'll be able to provide you a full assessment and individualized interventions with things like biofeedback or electrical stimulation. Keep watching this video to get the links to my other YouTube videos where I guide you through step-by-step how to do pelvic floor exercises correctly and other exercises you can do after prostatectomy to get dry and regain that continence. If this video is helpful, please be sure to like it, share it with someone who might benefit, and make sure to subscribe to my channel for more videos on pelvic health and cancer survivorship.